So we've been called to a mother who's meant to be giving birth. When we arrive at the scene, we'll do a quick assessment of the mother and the baby and see if everything's okay and sort of how imminent the baby is going to be. And that'll give us an indication of whether we're going to be having the baby at home or whether we have time to load her in the truck and head to the hospital. Right, so Tash, I just need to ask a few questions before we get started, before we make a plan. Have you had a bloody mucus sort of plug come out at all?
Yeah, last night.
Last night? Right, awesome. And have your waters broken at all?
Yeah.
Yep. When did they break?
Like an hour ago.
An hour ago? Right, I'm just going to note down the time of when her waters broke. And what sort of colour were your waters?
Like a yellowy, kind of clear colour.
Bit yellowy, that's really good. And do you have any idea how frequent your contractions are at the moment?
I haven't been timing, but they're definitely getting closer together.
Nice, that's good. What I'll get you to do then is let me know when you're feeling another one coming on, and I'll time it, and that will give us a bit of an indication with when the next, or sort of how soon the baby's going to be due. And do you have an urge at all to push or empty your bowels?
Yeah.
You do? Alright, that's pretty good. That might be, I mean, it's coming pretty soon. So it sounds like we're going to be having the baby here. I'm going to ask a few more questions just to make sure that there's no complications. If that would mean we'd have to go to the hospital, otherwise we're going to prepare to have the birth at home. So is this your first baby, Tash?
No, I have 2 others.
You've got 2 others?
Yeah.
Awesome. And have you had any sort of stillborns, abortions, miscarriages with your others? Right, so this is your 3rd pregnancy?
Yeah.
Awesome. So this gives Tash a parity to gravity score of 3 to 2, gravity to parity score. And how many weeks are you?
39 weeks and a day.
Awesome. And your due date?
May the 14th.
Ah, cool. And have you had any antenatal care at all?
Yeah, I got a midwife.
Oh, cool. And have you contacted your midwife?
Yeah, Pete called her, but she's just on her way back from Waiheke.
Ah, no, so she might be a bit of a while. Stressful. Have you experienced any problems with the pregnancy at all?
No.
No. And do you know from your midwife that your baby's in a good position?
Yeah, she said she was good.
Alright, that's good. And with your previous births and deliveries, have you had any trouble? No, no trouble. Awesome. Are you on any medication?
Just the vitamins, maybe.
Oh, cool. And do you have any sort of past medical history or conditions
No.
we should know about? Awesome. And what's your pain score like from 0 to 10 at the moment?
During the contractions, it's like really bad, so probably like a 10.
A 10 on contractions.
Yeah.
Would you like some pain management for that?
Yes, please.
You would? Okay, so what we have, it's called methoxyfluorines. It hasn't actually been tested on pregnant mums yet,
Yeah.
but there is no evidence to suggest that it causes any troubles, and I know it's really widely used in Australia. Would you be keen to give it a try? It's a gas.
Yeah.
Alright, awesome. So I just need to ask a few questions. Do you have any allergies? Awesome. And have you ever heard of malignant hypothermia?
No.
Awesome. And do you have any problems with your kidneys or any renal stuff?
No.
Cool. And have you seen this in the last week?
No.
Perfect. Alright, the way it works, I'm just going to pour the drug in. It's sort of like a whistle, so I need you to blow in really deep and then out through the whistle really deep as well, because it's going to filter the gas so we don't get high as well. It does taste a bit gross, it's got a bit of a metallic taste to it, but it's really good for the pain. So if you huff on that for your next few contractions, just blow in and out really strong, and a few deep breaths will make you feel better. Awesome. Tash, did you have a birthing plan at all?
Yeah, I just wanted to have her at home.
Oh, okay, awesome. I think that's what we're looking like we're doing, so that sounds good.
Cool.
In the meantime, we're going to start preparing for the birth. So we have our BBA kit out, all of our neonatal resus equipment here, ready to go when the baby comes. Plenty of towels, linen blankets. We've got our bluey under as well, just to help tidy up. We'll also be looking at things like keeping the environment warm and stuff. I'll get Pete to throw another log on the fire, so that should keep us nice and warm. And Tash said that the midwife is on her way, but I'll get my offsider to just give the midwife another call just to see how far away she is. If it does appear like Tash starts to hyperventilate or become distressed at all, coaching her on her breathing and that use of methoxyfluorine to help with her contractions will be a really big part of this as well. In the meantime, now that we've got everything set up, I'm going to take the mother's observations between your contractions. I'll be taking things like heart rate and blood pressure, just making sure that these are all within the normal ranges. It would be normal for the heart rate and the BP to be a bit elevated. This is quite understandable, just due to how much pain she's in. Did you have any notes from your previous checkups at all?
Yeah, Pete should have them.
Awesome. I can use the notes to help compare Tasha's average vital signs with what she was previously on, just to see if there's any abnormalities as well. And is it okay if I take a look down there?
Yeah.
Alright, awesome. Cool, so I was just looking to see if the baby's head was crowning or visible at all in the birth canal. If there's anything that's coming out that there shouldn't be, such as the umbilical cord, then we'd immediately have to transport to hospital, but everything looks okay down there for now. I'm also just checking to see how dilated you are. For when the baby's ready to come for the birth, the cervix should be about 10 millimetres dilated. That would mean that birth is imminent. If the birth is imminent, I'll be keeping an eye on the vagina, ready to assist the birthing of the baby. If it's not quite imminent but close, I'll be checking the vagina quite often for any changes and just keeping up to date with that. Once the baby's actively birthing, I'm going to place some light pressure on the perineum just to help slow that birthing down, and that should also help to reduce any tearing that could go on. Since the mum will also be in a lot of pain during this period, I'm going to just continue to reassure her and coach her through her breathing and stuff, and just encourage her as much as I can. If the baby's not progressing or it's taking quite a while, changing the mum's position to maybe a squat could really help. Sort of however the mum feels comfortable. Looks like the baby's coming now. So I'm going to get my offsider to quickly coach our patient with her breathing and
Go,
stuff.
Tash, take big deep breaths.
Get this off.
Have a push when
I
you
can
do
see it
that.
coming. Here it comes. I'm going to get my
doing
towel
so
ready to
well.
catch the baby in. There we go. Oh my gosh, the baby's out. You have a beautiful baby boy. I'm going to quickly dry it off and just try to stimulate the baby a bit to get a bit of reaction. I can hear it crying. Now my priority is to get it onto the mother so we can have a bit of skin on skin. There we go. We also just want to keep the baby warm, so we're going to use blankets and stuff. If there's any hats available as well, we'll use that. Alright, now my priority is to get an APGAR score, so that's just measuring the baby's activity, pulse, grimace, appearance and respiratory effort. So just do that now. Alright, so the pulse appears to be above 100, which is really good. For now, the baby does have a bit of a blue tint to it, but that's pretty normal as long as the baby pinks up within the next 5 minutes or so. All should be fine, but we'll just make sure that we double check that. Next stop is the placenta needs to be delivered. For now, we'll just leave the cord and we'll cut the cord after the placenta. So the placenta should normally be birthed within 30 minutes or so of the baby being born. But it looks like it's coming now. Alright, do you want to coach again? So here comes the placenta with the cord.
A few more, bit more, bit of...
Here we go, so we've got the placenta and the cord. So once the placenta's been born, we're just inspecting it to make sure that there's sort of like no obvious chunks missing, and that there's sort of like no other issues. Also just going to assess the mum, make sure that there's no excessive bleeding or postpartum hemorrhaging, and it all looks down okay as well. So now I'm going to get my offsider to clamp the cord at 10 to 15 seconds please. 10 to 15 centimetres please. Awesome, and mum, would you like to cut the cord?
Yes, please.
Alright, you can cut that if you would like, just cut it. Perfect. That is lovely. Alright, I'm going to give the placenta to my offside to put in the biohazard bag. We're going to make sure that we keep that for when the midwife arrives, so she can inspect it properly for us. Now our priority is to make a plan for the mother. So because the midwife isn't here, we will transport to hospital just so she can be continually monitored. We also need to recheck the APGAR score sort of every 10 to 15 minutes post-birth. If the midwife were to be here and I felt confident leaving the mum at home and she was happy to stay with no sort of complications, we could look at doing that as well.